Tonight we talk about chiropractic and whiplash and the effects of whiplash and what is whiplash and the types of whiplash. So we're going to dive into that tonight. Ben, do you want to kind of
Sure.
little intro?
Yeah. Yes. So yeah, whiplash, aka cervical acceleration deceleration syndrome. We'll be talking a little bit more about why that is in just a second. But a whiplash injury is an injury to your neck and head, right? So not just the neck, but also the brain is involved. It's caused by your neck bending forcibly forward and then backwards or vice versa. And so you get this whipping motion of the head. The injury, again, it's very much a multifactorial injury, especially if the condition's symptoms last for greater than 3 months, becomes very complicated. But it usually involves some muscles, tendons, the discs, the nerves. They're all under an increased amount of stress because of this injury. And so it becomes one of these conditions that is perfectly in the perfect condition to be treated by a chiropractor. Most whiplash injuries result from a collision, like a rear end collision, which causes an acceleration, then a deceleration. So rear end motor vehicle. They also happen as a result of a sport injury, particularly during a contact sport or during an accident or during an assault. And so whenever an individual is hit when they least expect it, that's when you're most likely to suffer a whiplash injury.
Yes, and definitely something that we see in the clinic a lot. And both the brain effect and the resulting symptoms of that, and also the neck effect of that stretching of those muscles and contraction afterwards. So definitely something that we definitely can see as a chiropractor. We're going to talk about that a little bit more and how chiropractors may help you with whiplash. So ready to move on?
Yeah.
Let's talk about it. Let's go.
So how does a whiplash occur? And this is the photo that I took to just sort of show the prime example. So this is the mechanism of injury. And so just imagine you're driving in your vehicle and essentially you have forces that will hold your head back into the seat, right? And then you have forces of the car driving forward, which then holds your pelvis nice and aligned in the seat as well. When you're hit from behind, like in a rear end collision, the pelvis will jut forward and the head and neck will whip back, right? And that's when you're hit from behind, the head and neck will whip back, jamming all of your facets and joints in the rear there. Then what'll happen is the head will whip forcibly forward. And if we're just thinking about the structure of the neck, it's not very good for it to whip from front to back because you're putting the neck under an undue amount of stress.
Yeah.
Now, not only just thinking from a neck perspective, we can also think about it from what's actually happening to the brain inside of its casing, inside of the skull. What's happening to the brain? So as you can imagine, if the head is whipping back forcibly, the brain sits inside of a fluid inside of the skull. And so it moves independently of the skull. So if the head is whipped back forcibly, the brain will then be slid anteriorly and it'll hit into the front of the skull. This in itself can cause damage to the brain. I'll let Dr. Roach maybe speak about why that's a significant part of the injury, because it leads to a lot of people's symptomatology, not even maybe acutely, but definitely over the long term.
Yeah. So, we always have to consider the state of the neck and the human being in the car accident prior to him having the trauma. So, most of the time people go into a trauma motor vehicle accident already having some neck dysfunction. Maybe they know about that neck dysfunction. Maybe they don't. Maybe they don't have any symptoms. But what will end up happening is when, as you explained, Ben, the brain bathes into the cerebral spinal fluid. So it's not attached to the skull per se. So the brain sits here, and as the head goes back, the front part of the skull comes in and bangs right into the brain. And then as the head comes back forward, the back of the skull comes and hits the posterior part, the back part of the brain. So that's what we call the contre-coup, which means that the brain gets hit twice in that whiplash motion. When there is trauma, there is disruption of what we call the blood-brain barrier. So that's the meshing that allows the brain to be protected from, all kinds of, stuff that's in our body, that undigested, uh, viruses, bacteria that can't cross that blood-brain barrier. But when there's trauma, that mesh starts to tear apart. So now we're able to have infiltration of stuff going to the brain, very commonly inflammation. So now you have an inflamed brain, which can cause stuff like headaches, confusion, brain fog, and a lot of the stuff that happens after a car accident, sometimes later, which is why in a car accident afterwards, you might feel okay and the symptoms start to come 2, 3, 4 weeks after. So always be careful to settle a car accident based on the fact that you feel good shortly after, because you might be surprised 2, 4, 6, 8 weeks later that symptoms start to come around from that brain contusion. Even though your neck might feel better, but now you're starting to have more like concussion type symptoms. So very, very important in a car accident.
Absolutely. So neck pain and stiffness, shoulder pain, low back pain, dizziness, right? So we're talking a lot about the vertigo, right? The lack of coordination, pain in the arms and hands, right? So we're talking about issues with the neck here, ringing in the ears, blurred vision. Just as an example, when the back of the brain hits the skull, that's where the occipital lobe is. And so this is where your actual sight processing takes place. And so if that area is damaged, of course, you'll experience some difficulties with vision, right? We've also got the frontal lobe in the front of the brain, which is responsible for our thoughts, right? And so our ability to think and process. And so when that area is impacted, our ability to concentrate and focus on the things that we're trying to do is disrupted.
Thoughts and also emotions, right? I have a lot of people that after a car accident are very emotional, like they become depressed, some of them hysterical, so like it changes their mood and behavior. That's the frontal lobe, right? So like Ben said, any part of the brain that's concussed and contused is going to display symptoms based on whatever that brain's functions are in that area.
Absolutely. And so they have, for symptoms, irritability, right? And so
Yeah.
again, that frontal lobe is involved. Sleeplessness, right? So an inability to calm down from this fight or flight, which is why a lot of people who are in car accidents will then experience PTSD, right? So a
Yeah.
lot of people will have these thoughts going through their head of, oh, will I get back into a car accident next time that I step into a car?
Yeah.
And this is because the brain was traumatized at that moment.
Yeah.
Fatigue. So I saw something down here, and I don't believe that is true. Most people who sustain a whiplash injury will recover within 3 months. I mean, the symptoms of the issue may slow down, they may go
Yeah.
away, but I guarantee you, if something small happens to the head or neck, the symptoms will return, and they'll return with a vengeance, because a lot of the stuff that were there even before the car accident are going to become more apparent even afterwards.
It definitely depends on your definition of recovery,
Yeah,
right?
absolutely. Absolutely.
Yeah, I don't know if I agree with that either.
Yeah.
Um, so when we look at whiplash associated disorders, so that's what the acronym WAD stands for. Whiplash associated disorders can be graded from 0 to 4. So we go through that all the time when we basically help the patient be covered with chiropractic care after they've been in a car accident, and we need to grade what kind of whiplash disorder it is. So basically, if you look here at the grading chart, a 0 is no complaint about the neck, no physical signs. A grade 1 is complaint of neck stiffness, tenderness only. The pain is not traveling anywhere. Again, very mild. Although I will say there's research that shows that a car accident at 5 miles an hour can create permanent damage, right? So sometimes, people say, oh, it was just a minor fender bender. Oh, yeah, minor fender bender. The airbag go off? Oh, yeah, the airbag went off. And I'm like, oh, this is not a minor fender bender, right? But sometimes it is a minor fender bender, but the patient does have long-standing issues from that. So yeah, so grade 2, Ben.
Yeah, grade 2 WAD. It's a neck complaint and musculoskeletal signs. And so musculoskeletal signs include decreased range of movement or point tenderness, right? And so you have neck pain, but then also you've got really limited ranges of motion, almost a shudder because it's so painful to move. And a shudder is just where the muscles are spastic. And so you can't achieve that range of motion, as well as point tenderness. And so
Yeah.
point tenderness is just when we're doing our motion palpation, we're feeling the joints, we're looking to see if they're moving properly, or if there's tenderness on the muscles themselves and they cause fasciculations. That's a WOD 2. WOD 3
Yeah.
is
So
a,
WAD, go ahead.
yes, sir, neck complaint and neurological signs. And so you have a neck complaint, neck pain, as well. You've got neurological signs, which include lack of sensation, lack of strength, or a lack of reflexive tone. And so those are what we would screen for in our neurological exam. So we're looking for neck pain and neurological signs. And most of the time, this isn't very good, especially post car accident.
Yeah.
And WOD 4 is a neck complaint with a fracture or a dislocation. So this has to be taken very, very seriously. You have to use your C-spine rules to determine if the individual needs to be x-rayed for a fracture or dislocation. Most of the time, if an individual is in a car accident, chances are I'll refer them for an x-ray regardless, because I'd like to rule this out and rule in any other things that could possibly give us a little more information on the individual's condition there.
Yeah. And obviously, if there is a WOD 4, those most of the time will need to bypass the chiropractor, at least for the neck complaint. It needs to be stabilized and, put into a collar and, take on the proper treatment protocols for a fracture, which are not going to be a neck adjustment, obviously. So just to be clear, chiropractor is very good at treating WOD 1s to WOD 3.
Yeah, I was about to say, if you know that you have a dislocation in your spine and you don't have that moved and put into the proper spot, then you're not in the right office, because a subluxation of the spine is very different than a dislocation of the spine.
Absolutely. Yeah. Not quite the same. All right.
Chiropractic and whiplash. And so we understand that one of the main causes of pain and disease is the misalignment and abnormal motion of the vertebrae in the spinal column. And again, this is called a subluxation, and this is what we base a lot of what we're looking for in the spine on. And so as you can see, the x-ray to the left has a beautiful spinal curve. It's got a nice 42 degrees, and it's labeled below there. I don't know if you guys can see it, that this is the normal curvature of the spine. This is pre-collision, so this is pre-motor vehicle accident. And so this individual's got no dislocations, no slippages, no DDD, degenerative disc disease, no arthritis or anything like that. Then we look to the photo to the right there, and we see that this is the individual's spine post-motor vehicle accident. And so immediately, what's the number one thing that we talk about? Most episodes on Hump Day Conversation, we talked about the curves of the spine, and we can see just how straightened that spinal curve has gotten. It's very hypolordotic. You can see that straight line.
So one of the things that Ben was saying there, that within 3 months, typically motor vehicle accidents recover. So if the person on the right here with the straight curve has no symptoms, has he or she recovered? Right? Well, if there's no pain, we could say, yeah, they're symptomatically, like they're symptom free, but their neck is still a mess. The curve is gone. Muscles are going to react to this over a period of time, causing the spine to degenerate, have degenerative disc disease, eventually have bony encroachment where the nerve exits from the spine in these small little holes. And now you've got nerve compression, pain going down the arm, which happens sometimes 5, 6, 7 years after the car accident. And now here you are stuck trying to prove that this was from the car accident 7 years ago. It's a little bit of a challenge. So don't be fooled when the pain goes away. It's all about the structure and what it looks like, because by no means is the spine on the right a normal spine, regardless if there is pain or not.
Yeah, just as an example as well, like, you know, an individual who was in a car accident, 10 years ago, they come to our office and they say, yeah, I was in a car accident, but I actually didn't feel anything. And then I had this fall the other day, and it seems like after this fall, everything's gone downhill, right? And so the spine was already in a position, in a fragile position to begin with, where, any other sudden move, any other trauma would lead to the eventual symptomatology, right? And so don't be fooled by the fact that you have symptoms or not.
Yeah.
The symptom wasn't the issue from the beginning. The
Yeah.
symptom is just now the result of poor structure over time that had then failed you. And now
Yeah.
you need some work to really restore that structure. And sometimes you're going to have to put in a lot more work than what you would have had to do just after your car accident to correct that.
Hmm. So in terms of the effectiveness of chiropractic care, there's been a study that was done that basically compared uh, a lot of years. I'm not sure at the exact amount of years that this was in, but and what they did is they compared um, motor vehicle accident claims, people that have been to massage therapists, physiotherapists, chiropractors, and what they looked at was the length of time they were treated, the outcomes, how good they were, and how much money was spent using those practitioners. And what they found out over, I believe it was 10 years of data, that chiropractic was far better in terms of cost effectiveness as a treatment for whiplash associated disorders than any other profession. Here's why I think this is the reason. I feel that in the beginning, structure, joint movement needs to be restored before muscles can be rehabbed, because muscles in that moment in time are told by the brain to protect the dysfunction and tighten up and spasm so that you restrict your movement, because the dysfunction that's there will not like if you move your neck too much. So what needs to be done is the dysfunction needs to be fixed, get the spine to move better, so that the brain now gets feedback from the spine and can now tell the muscles to relax. So when you try to rehab a muscle and stretch a muscle that's attaching to a spine that's immobile, that makes it very hard to get progress, because you're always coming up against a roadblock, which is the amount of movement that can be had from the spine, which is now traumatized from the accident.
Yeah. And so we have to go in there as the chiropractor and determine where are the areas that aren't moving enough. How can we break this cycle, the spastic cycle that the spine is in, where it's trying to protect itself because it thinks that it's under some type of trauma. And so by
Yeah.
adjusting the spine, we can reorganize the amount of input that's being put to the joint from the brain, cause the area to calm down and restore the proper curves and proper structure to the spine, and eventually lead to a better, happier, healthier spine for years to come that won't be traumatized by the next thing that that causes it pain, that causes it dysfunction, or that causes it to come out of alignment. So
Yeah.
by working on the spine, making it more resilient. So even if you feel normal, basically what we're trying to say here is, even if you feel normal after a car accident or after an issue with your neck, you should definitely still have your neck thoroughly examined to determine what state the neck is actually in. Because these symptoms can be delayed for days and sometimes cannot even surface after years. So it's
Yeah.
better to have it checked early than to have a little thing happen later on that leads to a big, big, big problem.
So if you can right now, I know we've said a lot, but if you've learned something from what we've done so far and what we've said so far, just please give us a little bit of a reaction here, thumbs up or a little bit of a heart, that you're learning something. Because I think this is really important to understand, because a lot of times people will go into a car accident, they are getting hit with paperwork to fill out, and the language is sometimes complicated, and sometimes the paperwork is more painful than the darn accident, right? So to be able to come to a chiropractic office that knows what they're doing, and somebody that can take you through that process and teach you something in the meantime about what a whiplash injury is, I think it helps put the patient at ease, understanding the why behind what we're going to go through and what the patient is going to go through in that process. So please, if you like this episode, just give us a little bit of a thumbs up. And if you're watching this on YouTube, make sure you subscribe to our channel to watch some of our other episodes.
Absolutely. And so I also read something as well about, whiplash disorders, neck pain, brain fog. So even after you have, that you're in a car accident, you're experiencing symptoms, they say that it's good to do a little bit of aerobic exercise. And so begin to feed the brain with proper oxygen and healing factors to work the brain and keep everything moving. And so even after you've sustained a whiplash injury, they say a little bit of aerobic activity, and they recommend biking is great, as well as having your entire neck examined and looked at to determine if the function and structure of the spine is doing well. Now, I've also got this slide here of the 3 phases of chiropractic care. And so phase 1 is the relief care. And so that means that you're in an acute phase. And so this means that you're under some type of pain, because unfortunately, most people come to see a chiropractor when they're in pain. And so we want to be able to help you with restoring that function and that structure and breaking this painful cycle that's happening. And so relief care, that's when you finally get relief from the symptoms. Phase 2 is corrective care. And so corrective care is when we're really trying to restore that structure. We're trying to do it the entire time, but now the symptoms are gone. And so we're restoring that structure and ensuring that the symptoms do not return. During this phase, the symptoms may come back or they may not, but that's okay, because that's the whole point of corrective care. Had you just left after your symptoms were gone, then you'd probably be worse off if you saw us again. And so we have corrective care to maintain that structure. Phase 3 is maintenance care. And so this is when the symptoms have been gone and they don't return. And we're continuing to treat and maintain that structure so that they don't come back. So that when there are little things that do happen, the body is more resilient and you're in a better place to begin with than you were, 4 or 5 months ago when you first started your chiropractic journey. And so be prepared to undergo 3 phases of care: the relief of care, the corrective care, and then when you're able to maintain your structure for years and years to come.
But Dr. Roach, after phase 2, if the correction is done, why do I need to continue to come back? Well, my answer to that is always, well, do you still sit at your desk all day long at your job? Do you still lift? Do you still, bend? Do you still run? Do you still lift weights? Do you still have stress in your life? And if the answer to that is yes, and if it isn't yes, they're lying. We need to continue to build a strong spine and catch things as the body is accumulating stress, so that our body is able to adapt to that stress along the way. So in other words, if you continue to eat sugar, it doesn't really matter how long you've brushed your teeth for. If you stop brushing your teeth, the sugar is going to take over and you're going to have tooth decay. Well, the spine is no different. We just call it spinal decay, also known as arthritis, right? So one thing I wanted to point out in phase 1, 2, and 3, there are 3 phases of care. If all that care was to get rid of pain, there would only be one phase called relief care. And if that was the case, it would be much cheaper to take a Tylenol and enough drugs to numb the pain, right? Which is all relief care is going to do, is going to make the pain go away. And then we get into the corrective care, which is actually creating the better structure that allowed the pain to come forth, right? And then once you get there, the braces come off and you want to wear your retainer in order to maintain that correction. So very important that people understand that. Whether you're in a whiplash injury or not, most of the time we're not in a place where people come in and say, hey, I thought chiropractic, was important in my life. Somebody told me, and I want to come in so that you can check my spine. No, it doesn't happen that way. People come in with a problem. They say, I've got low back pain, I got sciatica, I got neck pain. So there's always a relief care phase, followed by a corrective care phase, followed by a maintenance care phase if the patient so desires to stay out of pain and not wait for it to come back.
Absolutely. So for example, and I mean this is primo. Um, I had a patient who came in. She just started chiropractic care. Ever since we started adjusting, she's been feeling great. None of the tension in her neck, mid back, none of that pain has been coming back. Now, that being said, I saw this individual on Thursday and she had a busy weekend. So she was out, she did a lot of driving. She took her kids to and from sports events. She was watching sports events and she's heavily involved in that. And so she found this entire weekend quite stressful. So when I saw her on Monday morning, she came in and she said, no, I had a stressful weekend. She said, but I don't have any pain. I said, I don't have any pain, but I had a stressful weekend. And so I said, okay, well, perfect. Sounds like you had a good weekend and that everything was going well. I'm really happy that you don't have any pain. But, you know, just because she doesn't have any pain doesn't mean that I'm like overly happy about that, because we only just started care. We're only in the relief phase. And so I had her go face down on the table so I could do my assessment and see how it was that she was doing. And the amount of tension in her back and neck was supreme. And so I told her, your back and the muscle tension is very high. And so we treated and it released it and everything was moving a lot better. And I told her, had you not come in today and had you stopped care because you were just feeling good, that tension, that stress on your spine would have built up and you would have had a flare. That is why we do it. It's because you want to be able to empty the cup before it spills over.
Yeah.
So this is the idea, and that's how it works.
One of the best analogies, like, what comes first, the plaquing in the arteries or the heart attack, right? What comes first, the structural dysfunction or the pain, right? So many times chiropractic works so great that when people get out of pain in 5-6 days, they say, oh, you fixed me, doc. Thank you so much. Because everything in our society from the day that we're born is based on a treatment plan that starts and ends, right? You take antibiotics, 7 days. Day 1, day 2, 5, 6, 7, and you're done, right? You go through treatment plans and they start and they end. So when we're looking at a holistic treatment plan, maintenance, sometimes, we're not used to that. So again, health does not mean the absence of symptoms. Health means everything working optimally from a physical, chemical, and emotional standpoint. So we got to take into account the whole body and function, not just symptoms. All right. Serenity PM. So we talked about this one last week because we were talking about sleep, obviously. Serenity PM, the ability to boost serotonin. Many of you might be familiar with serotonin. Those of you who might be on antidepressants, they are known as serotonin reuptake inhibitors. So basically, they leave serotonin in the brain so they don't get uptake. So serotonin is a good thing to boost mood. GABA, melatonin. So Serenity PM often given to people that have a hard time staying asleep, that basically wake up middle of the night many times because of cortisol spikes. So a very good supplement is that many people come in and just buy that because they've noticed a big improvement.
I recommended it to a patient today and I was talking to her about it. I was just saying, we have these great supplements. We've got Serenity PM, magnesium. I said they'll help you sleep. And then she said, well, my problem isn't falling asleep. She said, my problem is that I wake up too soon. And she's like, I can't stay asleep. And I said, well, no, that's part of what this does. That's part of what magnesium and Serenity PM do, is they regulate your sleep-wake cycle.
Yeah.
Because you're having stress hormone, you're having wakeful hormones release at the wrong times during the evening. And so your circadian rhythms and your clock isn't regulated. And so these types of supplements are what's going to help regulate that system so that you stay asleep throughout the entire night and you're waking up when you're supposed to.
Yeah. And when cortisol spikes, the body thinks it's the morning, right? So everything starts to wake. So, all right. So this was our topic for today: whiplash associated disorders and chiropractic care. So give us some thumbs up tonight if you enjoyed this talk on whiplash. If you have any questions about whiplash, right? And if you've been into a whiplash accident, maybe you've been in one, you never really told us because you thought it wasn't important because it was so long ago. Maybe some of the things you're experiencing are related to that whiplash injury. So make sure you speak up and let us know, because sometimes things you didn't think were important are actually important to us, right? So what else, Ben?
Don't be fooled. Like if you don't have symptoms,
Don't be fooled.
right? Don't be fooled. If you don't have symptoms, it doesn't mean that you can't be treated by a chiropractor. I think, we definitely
Misconception.
have a misconception that, I need to be in pain to do these things, right? But no, there's lots of people that we see in our practice, they're not in pain. They're looking to feel better. Chiropractic optimizes their life.
You don't need to have a vision problem to see an optometrist, right?
See an optometrist, you need to have your eyes checked to see if your eyes are optimal, just like you need to see a chiropractor to see how your spine is and see if your spine is optimal, and to get that adjustment. Because there's a lot more that chiropractic can do for you than just getting you out of pain. And most of the time, that's just the first step.
Absolutely. As you saw, 3 phases, right? Relief care, corrective care, and maintenance care. So I think this was a great talk.
Yeah, absolutely.
Whiplash disorders. Now you know where to go. Which, by the way, in Nova Scotia, I think we need to mention this. In Nova Scotia, it is your choice who you choose to see, right? You go into a car accident, they cannot, I repeat, they cannot force you to go to a physio or a chiropractor. It is your choice of who you need or want to see. Okay.
Chiropractic and Whiplash Hump Day Conversation number 36 with Dr. Clayton Roach and Dr. Ben Boudreau from Roach Chiropractic Center in Bedford, Nova Scotia, Canada. Hope you guys are having a great week so far.
Hit us up on YouTube, Facebook. Make sure you subscribe on YouTube, Facebook. We're live every Wednesday night at 9 o'clock. So thank you to all our listeners. As always, we're very grateful that you are here every night with us. And we're very grateful to have information to share too, right? Like, we've been in this journey for a long time, being chiropractors and being in the trenches every day, treating people and acquiring knowledge on, function of the spine and all kinds of conditions. So we feel grateful to be able to share that information. Part of being a chiropractor is teaching and sharing this information so that you can become better patients as well, more in tune with your body, more intelligent, being able to ask better questions, which was the birth of Hump Day Conversation. So with that, have a great night. We look forward to seeing you next week, same time, same channel. Dr. Ben and Dr. Clayton saying good night. Thank you so much. Bye-bye.
What's up, guys?
Listen, if you like this episode, you'll probably like the other ones. Chances are pretty good. So here's what you need to do. You need to like us and follow us on Facebook. Following means you get notified when these two guys
are live.
Next, family, friends. You need to share these episodes because you never know. You might help them because they need this information as well.
And guys, if you ever miss an episode, make sure you subscribe to us on YouTube. That way you can watch the episode over and over and over again.
Guys, we love you and appreciate you.
Take care.